My name is Guilherme Oliveira. I'm Director of Heart Failure and Onco-Cardiology at the Harrington Heart and Vascular Institute, University Hospital's Case Medical Center. Today, I'm going to be discussing the article entitled Prevalence of Pre-Existing Cardiovascular Disease in Patients with Different Types of Cancer, the Unmet Need for Onco-Cardiology. It will appear in an upcoming issue of the Mayo Clinic Proceedings. So the unique aspect of this report is that we looked at a database of over 7 million people, of whom 200,000 had cancer. What we found was that of these 200,000, about 50% had some form of cardiovascular disease. Despite the fact that 50% of patients with cancer are at risk or have coronary disease, only less than 50% of them are either being treated for cardiovascular disease or being seen by a cardiovascular specialist. These findings are extremely important for clinical practice. The reason is that cardiovascular morbidity and mortality negatively impact success of cancer survival. If we know that 50% of patients with cancer are likely to have cardiovascular disease pre-existing, we need to be very aggressive in addressing that risk and minimizing it. So these findings are extremely important for patients because by recognizing the problem, we can address it. If we know that, for example, 35% of patients with lung cancer have coronary disease, we'll be more efficient and more proactive in unveiling this disease and treating it. So to summarize, our findings show that about 50% of patients with cancer have some kind of cardiovascular disease. Despite that, this disease is not being treated either with medications or being followed by cardiovascular specialists. This is a clear unmet need for oncocardiology specialists. As important as our findings may be, they need to be confirmed in the future by appropriate clinical trials. That's what we plan to do going forward. So our research, important as it is, has limitations, and I think the important part will be to confirm these findings in future clinical trials. For example, it's going to be very important to improve methods of diagnosis and screening of cardiovascular disease in upcoming clinical cancer trials. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.